Hello, and welcome to the U.S. Chamber Foundation's Path Forward series. If you've been joining us regularly, welcome back. And if this is your first time with us, we're really glad that you're here. It's hard to believe that we've been doing this program for 13 months as we've been helping America think about the path forward, back to health, back to economic health, back to work, as I think we're all eager to get. And it's really hard to believe that 13 months has gone by in some ways, right? In some ways, it feels like 13 years. In some ways, it feels like 13 minutes. But it was, in fact, 13 months ago that the first man was diagnosed with COVID-19 in the United States. And that was in Washington State, our focus for today's program. We know that that state then quickly became the first to have to deal with diagnosis and to have to help lead our nation in the path forward through this disease. They've been sharing lessons and insights along the way as we've gone, and they've truly been an example of how public-private partnerships are part of the solution. Now, last spring on this program, I had the pleasure of hosting Washington State's COVID-19 healthcare czar. And one of the things that we talked about was the role the businesses would play in the coming year in combating the disease. So now here we are nearly a year later, and Washington State is still on the forefront of this battle and delivering vaccines and delivering public partnerships in ways that we believe there are lessons for the rest of the country to learn from. I'm reminded of what Dr. Fauci told me on this program when he said the business community is so essential to everything that we do, even our health. To have a healthy community, you have to have a healthy business community. We know that business has a crucial effort, a crucial role to play in this public health effort. And at the U.S. Chamber of Commerce, we recently launched the Rally for Recovery commitment, asking businesses to pledge to do their part to protect their employees, their customers, and their communities, and help reignite our economy. In Washington, we're seeing that idea come to life as the state government and local businesses work together on a historic effort. Today, we're going to look at how the state has been successful in leveraging the strengths of the private sector and what we can apply in other states from what they've learned there. We're delighted to be joined by Washington Governor Jay Inslee to discuss his administration's work. We're also joined by Brad Smith, the president of Microsoft, to discuss how Microsoft has participated with the government on the vaccine rollout in that state. And we're very pleased to welcome Shannon Garcia, Senior Vice President of U.S. Operations at Starbucks, to discuss how Starbucks is helping with the operational efficiency of the entire effort. I'm sure we all have a lot we want to hear from them, so let's jump right in. Governor, let me start with you. How is your state faring?
Well, first off, thanks for inviting me. I appreciate this opportunity to talk about our state. We just had 5,000. We've lost 5,000 Washingtonians in this pandemic, and that's very painful to us. These are family members. These are not statistics. So the first thing I would say is we've had the pain of loss and economic challenges and personal challenges galore. But how we're faring is relatively well relative to the challenges we have faced. And we're going to talk about the fact that we have a lot of enlightened business leadership in our state that has allowed us to do that. If I may first just tell you about the fact that we've saved a lot of lives in our state, in part because of that. We have very low infection and mortality rate in our state, one of the best in the nation. In fact, had we had the same mortality rate as South Dakota or Arizona, we would have lost another 10 to 11,000 people in our state. So we've saved a lot of lives, even in the face of our huge loss. It's something that we should give us some confidence moving forward. And one of the reasons we have been successful is because of that enlightened business leadership. And we're going to talk about the partnership that we have formed. But I wanted to note that some of our success was because some things that our businesses did on their own initiative without government either requiring or participating. One of the things they've done is early in this pandemic has moved to a telecommuting model very quickly on their own initiative. And this is, we think, was one of the reasons why we kept our infection rates down early. Now, we also did some things by requirement of the government, which was early and also very successful. but it was an early instance of how business leadership can make a difference. Now, obviously, we are just thrilled beyond all human imagination to have these 3 vaccines available. This is a miracle. To think that we could have 3 vaccines at this point in the pandemic is an incredible testament to entrepreneurs and working people and who put these things together, and they should be celebrated. So we're celebrating this. We're rapidly increasing our vaccination. And again, it has become much more effective because of this partnership with our Vaccine Command and Coordination Center. So we've increased our vaccinations. We started about 13,000 a day. We're now about close to an average of 40,000. We've done 50,000 a day in a few days this last week. And in part because we've been able to work with the business community in ways we'll talk about. So it's the sky's the limit. The Biden administration has been very successful increasing the production of these vaccines. We're so grateful for that, for him to use the Defense Production Act, for him to come up with these new agreements, and congratulations to the companies that are working together. So I would say we're hitting on all cylinders, and we're going as fast as we can.
So you recently launched a program, Healthy Washington, the Roadmap to Recovery, which, as I understand it, is a regional approach to some of the efforts here. Can you talk to us about the roadmap and how it's going?
Well, we've established a plan to reopen our economy dependent on metrics. We're very metrics driven, we're data driven, and we're science driven. And I think it is one of the reasons we have succeeded in saving thousands of lives and keeping one of the best economic stories in the country, even with all our dislocation, because we have followed science. And so this is a science-driven plan. It basically creates regions in the state, multi-county regions, and we move forward with more economic activity, reopening our activity in our restaurants and our gyms and our theaters and the like, dependent on the metrics of performance. And we have several metrics of performance, including the raw data infection rates, the hospitalization rates, the ICU capacity, and the positivity. So we have benchmarks, and as those regions meet them, we advance our economic activity. And thankfully, we've now been able to advance our entire state last week or the week before last into the next phase 2, which increases activity. We now have 25% occupancy in our restaurants and gyms and the like. We're getting a lot of activity back in, and we're very happy about that. Entrepreneurs have been very innovative during this time, but having more people in the business certainly helps. Now we're evaluating the next step, looking at the science of the variants and the science of the efficaciousness of the vaccines to determine what the next metric should be for reopening our economy. I do think we're making good science-based decisions. We are not out of the woods yet. As you noticed, we've had such tremendous decline of 50 to 75% in various states. But unfortunately, that looks like that decline has plateaued and in some places has actually gone up in this country. So we still have a very significant threat on our hands, particularly with these new variants coming online. I just was briefed today about this. They are increasing in our communities, and we've just got to stay on top of them.
So turning to the topic of the COVID-19 vaccine, how has that rollout been going, and what have the challenges been?
There is a very simple challenge. I represent 7 million people, and I'm getting, hopefully in a few days, a couple 100,000 doses. And that's a challenge. That's the fundamental challenge. It's a life-saving product with, 50 times more people who want it today than we have access to. So that's the fundamental challenge. But let me talk about the good news, though, first, before the challenges. Look, we got briefing today from Pfizer. They're going to go from 45, a cumulative of 45 last month to 120 by the end of this month. That's an incredible rate of progress, and about 300 in the next month or two. So Moderna is also doing that. Of course, J&J is now coming on. So there's tremendous ramp up of production capability. And this is a miracle, not only the vaccine itself, but the production capability of the entrepreneurs who've done this their willingness to collaborate, and their willingness to make the investment. The fact that these companies started to produce this product before it was approved, that is a blessing. We should be very thankful for it. So there's a lot of good news as far as the production, but the challenge is prioritizing a life-saving product among 7 million people. And I know people on this call, none of them would volunteer to be governor of any state right now, even though it's a wonderful job. Trying to decide who should get this life-saving drug first. There's 7 million arguments for that, and we've tried to make some very difficult decisions. We started, of course, with the healthcare community and folks in nursing care and long-term care facilities. We then in our state moved to older folks because they represent 90% of the fatalities. These are if you're going to save lives, that's the way to do it, is to save lives, which is to get into the arms of older community. Our next phase was going to be essential workers, educators, agricultural workers, bus drivers, childcare workers, police and fire. That got changed a little bit by yesterday. The president advanced teachers and educators in that, and childcare workers advanced them into the immediate tier. So we're implementing that at the president's direction. So that's the challenge. We're making the best decisions we can, and it's a good day we can save lives, and we've saved thousands of them in our state.
Governor, thank you for that. Washington has really been a leader in the topic of today's show, which is really how public-private partnerships are saving the day, right? You've said wonderful, generous, important, and true things, I think, about business and its role in getting America through this pandemic. But it's also true that these private-public partnerships have been important, and you've led the way with companies like Microsoft and Starbucks and Costco. And so talk to us a little bit about what governors, political leaders, and business leaders in other states might learn from the partnerships you've put together.
Well, the first thing you would learn is get lucky and have business leaders like I have in my state. We have such an enlightened group of people who are willing to be committed to their community. They understand if their community thrives, so do their businesses. And that is certainly true. This kind of started talking to Kevin Johnson at Starbucks, and it has just snowballed and has been extremely productive in so many different ways for us to work together. Just give you some examples. So Microsoft is hosting mass vaccination sites, but also helping with our software dramatically. And obviously, we'd like to have the best user experience to try to get appointments that Microsoft is helping us on. They have pitched in big time, and some of this is on their own nickel because they're a great philanthropy as well as a good business. But a lot of it is just conjoining their enterprise with ours in a close partnership, and that's been helpful. I think about Starbucks. We started up, we were not getting as much production as we wanted early in this, so we stood up some of the early mass vaccination sites. And when we did that, Starbucks used their logistical team to dramatically increase the throughput. I was at a little site in Ridgefield in Southwest Washington at a county fair site, and I was down there, and they appeared to me a very efficient system when I was there, but Starbucks logistical team came in a couple days later and improved it, I don't know, 20, 30, 40% as far as their throughput. And of course, they're masters of that effort. Kaiser Permanente has helped stand up a logistical system for vaccinating educators so that that can start in early dimensions. Costco has been very effective in helping us think through a lot of this logistical, and I should have named every company that's involved, but those things have just made our system much more efficient. We've also brought in sort of a master commander, and he has every day come up with a new idea that has put the government to work as well. So, I think it's sort of like the last line of Casablanca. I think this was the beginning of a beautiful friendship, and I commend it to people and other governors across the country.
Governor, I really appreciate that. And I know that we'll have audience questions for you in just a minute. But before we do that, let me bring in Brad Smith, the president of Microsoft. Brad, thank you for being with us today. You just heard the governor talk about Microsoft's role in being so helpful to the state. Talk to us a little bit about why it was so important to you to step up in this time.
For all of us across the business community, as Governor Inslee explained, we recognized that we could do more together under the governor's leadership to help support the public distribution of these vaccines. We are really fortunate to have a lot of leading companies in our state, household names like Starbucks and Costco and Expedia and Amazon and Boeing and Microsoft. And I think we recognized, in part because of the work we've done with the governor and the state over the past year, that we could help address the logistical aspects of vaccine distribution. I think it was very clear to us early on that fundamentally all the conversation about vaccines was really about two things. One is who should get it in what order, which is a policy question. But then the second is, well, how to get it to anybody, and especially a lot of people simultaneously. And that is all about logistics. And that's something that companies do every single day.
That leads me in a couple of different directions at once, but I'll try to stay focused and ask you what I think business leaders most want to hear from you, which is we hear from companies frequently across the country who would like to participate in setting up mass vaccination sites. So I'm sure they'd like to hear your insights into, what steps did you take to set this up and what did you learn from it?
Yeah, one of the things that we have done at Microsoft is set up a mass vaccination site. Obviously, the first question you have to ask if you're interested is, do you have a facility that you can put to use? We have a large conference center. It's not being used, so that was easy. The second thing I think you need to assess is whether you have partners you can work with. If you just try to enter the vaccination business alone, it's probably not going to be that big a contribution. So in our case, what we have done is partner with 2 local hospitals, and they were able to move all of their vaccination work to our conference center. And then by being here, we were able to work with them to grow their capacity. The third thing I think you can ask yourself is then what more can you do aside from offer your space in partnership? And we did a few things here at Microsoft. First, we decided that we were willing to cover the personnel costs ourselves to pay the vaccinators and the support personnel. We are not just hiring our own people, we're working with a third party, Optum, so we contracted with them. They're bringing in the trained people. But it is a $4 million a month cost for Microsoft. But what that does is it takes insurance reimbursement, Medicare, Medicaid, out of the cost equation, and it makes our site particularly well positioned to serve people who are uninsured, who may not qualify for Medicare. And so when we think about something like equity and reaching more people, we decided that this was a place where we could make a difference. We have the capacity to grow to 5,400 vaccines a day. Right now, we've just had our 7,000th vaccine cumulatively. We opened on February 26th, so we're still growing. But with this combination of other partners and then with our county and with the state, I think what we've really tried to do is ask ourselves not only how can we grow capacity, but how can we grow capacity in a way that will be most useful to meeting the state's broad set of objectives.
Looking beyond the state, as I understand it, you have an AI for health sciences team that's helped develop vaccine distribution tracking systems for not just the 50 states, but around the globe. I think our audience would be interested to hear more about that and also why you think the vaccine tracker is such an important tool.
We got involved in this about a year ago through our AI for Health team. One of the first projects we took on was working with the Washington Department of Health to stand up a data dashboard that is operating today. Every single day, you can go in and you can see for each county or for the state, all the epidemiological curves, the case rates, hospitalization, and now vaccines. And as you mentioned, we've now done this in partnership with universities and other governments. So there's been one dashboard where you can see every state and you can see every country. It is obviously something that is critically dependent on tracking data. Some of this is at an individual level, so we support that, say, in Washington and some other states. But cumulatively, we need to know, how are we doing? The public needs to know, how is its government doing? And I think people do like to compare, how are we doing versus, say, the two countries that are ahead of the U.S. right now, say, Israel and the United Kingdom. And I think that's frankly also part of just giving us all a sense of when will normalcy return, because it can't return in a single state until it returns across the country, and to some degree until we get back to normalcy, meaning a high level of vaccines around the world.
I think that's absolutely right. Turning for a minute to Microsoft as an employer, do you imagine requiring employees to have vaccines before they return to work?
We won't require that they have a vaccine to come back to the office. That's really not consistent with the ethos of the tech sector. I suspect we would have people who would object simply if we insisted on it. We have a workforce, the whole tech sector has a workforce that really prides itself on its creative independence and its independence in every other way. But we will absolutely, use our pulpit to encourage everybody to get a vaccine. Well, we already are doing that. I am looking forward to the day when I will be eligible and can get one, and I'm very hopeful that you're going to see a virtually universal, if not universal, desire among our employees to go get a vaccine.
We've heard some employers theorize about maybe creating incentives for their employees to get vaccinated. What do you think of that idea?
Well, I think it's a great question. And I think this is just an example of where different businesses, different industries in different parts of the country might just have somewhat different cultures. So you could easily imagine giving a bonus to somebody if they get a vaccine, enabling them to participate in certain events if they do instead of if they don't. I think each business and industry needs to find its own way.
You heard a minute ago the governor talk about Pfizer's increasing the number of available vaccines. We heard the J&J coming online. The president announced yesterday that it looked like every American who wanted a shot, would there be enough of them by May? I'm finding the numbers a little bit confusing, just kind of hard to follow. So what do you think the next 6 months looks like for this vaccine rollout?
Well, and I think your question points directly to what we all need to be doing where we get involved in these kinds of efforts. It is hugely important that we build distribution capacity ahead of supply, because we're going to see an enormous increase in supply. Governor Inslee was just talking about what the next few weeks holds for us here, and that's just great news. And that's really been the strategy behind the public-private partnership here in Washington State. I think what we're going to need to see across the country is what Governor Inslee has done here, and that starts with a clear goal. In January, he said our goal was to build as a state the capacity to administer 45,000 shots a day. At the time, we were only at 13,000, but that told everybody this is how we need to direct our energy. Already we're up to 37,000 shots a day. We're going to hit 45,000, and I'm sure we're going to start talking soon about what's the next goal, because you can see how that number is going to continue to rise. That is what we all will see. Then it really comes down to continuing to build that logistical supply capacity. And what we've learned here in Washington State by bringing everybody together is that it's fundamentally about getting vaccines to facilities where there are vaccinators and support personnel, all supported by technology, so that we can vaccinate as many people as we have doses available on a given day, all on sort of this foundation of broad public education and support. And the other thing I just think we've learned so clearly here is businesses have unique opportunities not to contribute everywhere. You have to contribute where you actually have something that you can provide. But where we get the kind of leadership we've had from a governor, like we've had with Governor Inslee, where you get that kind of role clarity so that you know what your role is, what your lane is. And when you get this, what we have here, a command center, as Governor Inslee said, so that they're pulling everybody to work together, I think that's how you develop the confidence that if there's a day when we have 100,000 or 150,000 shots available for a day, we can build the distribution capacity for that.
It's really exciting to be at this point in the curve where we're even talking about that, isn't it? I mean, it has been such a miracle to have these vaccines online so quickly. And to your point, whether it was the companies producing the dry ice, the FedEx and UPSs with the shipment plans, the storage plans, it's been really amazing kind of whole of business and government effort to watch. Let me ask you a question before we bring in our next panelist, and that is, what makes you optimistic at this point in the pandemic? What makes you optimistic about the future?
Well, look, I'm just optimistic that we are talking about the problems that we're talking about today. We're talking about how to get multiple vaccines in very large quantities into everybody's arm in America. Oh my gosh, that is so much better than what we were talking about a year ago. It was a year ago tomorrow that at Microsoft and across Puget Sound, we asked our employees to work from home. And I'm optimistic because I really do think that this is a great reminder of not just the science that this country produces that got us to this point, but the logistical capacity that our private sector can bring to bear under government leadership. I do think that you need real role clarity with the public elected leaders leading and companies like ours supporting. But we are adapting, we're learning. Every day is actually hard. When I look at the technology problems, there are days when I feel like we're trying to build a house out of spaghetti in a hurricane, knitting together 1,100 providers with different information technology systems. But it shows what we can do in this country when we have that clear problem to solve, a public-private spirit, and the kind of leadership that we're really fortunate to have in this state.
I really want to underline your point about role clarity. I think we see that a lot in all types of public-private partnerships, but you've really brought that home today with those examples. We're going to bring you back in, I'm sure, with some questions from the audience, but thank you for that. And let me turn and bring in our next guest, Shannon Garcia, who is Senior Vice President of Operations, U.S. Operations for Starbucks. Shannon, thank you for joining us today. So it's so interesting to read about this. You have, 30,000 stores around the world. You serve 100 million customers a week. You make at least 10 million drinks a week for my teenage daughter. I think that's the rough number. At least that's what it looks like on my credit card statement. But thinking about the supply chain expertise that takes and how you brought that to bear on vaccine distribution is just fascinating. Tell us more about it.
Yeah, thank you. And thank you to your teenage daughter as well for the support. But I would say, as we look at this coalition in support of Governor Inslee's mission and our public-private partnership, this really is an opportunity to use our expertise to help serve our communities. And we started by asking, how might we help this effort? And it began with a lot of research and a lot of learning. We looked at sites across Washington and how they were operating. We researched states across the US. And also countries across the globe. Brad mentioned a few of those. And we really set out to understand what makes them successful. So that's how we started.
Another piece of your expertise that you brought forward is really on customer experience, or in this case, patient experience. And so tell us what you learned from that. What have you been hearing about the experiences to date?
Yeah, thank you for that. I mean, clearly we're not experts in healthcare, but we certainly are experts in delivering on the customer experience. And, what we really wanted to anchor to is the patient experience. We wanted to keep that top of mind. We know that confidence in the vaccine is something that we are all across the country looking to encourage and build upon. And we focused on things like minimizing wait times and increasing efficiencies for the patients, for the patient experience. And we also learned from just a lot of rich dialogue with our healthcare workers that many people are arriving to these sites with anxiety. And so we created ways, whether it was to move from, a simple map and for the patient to understand the experience, or even just wayfinding. When we think about equitable access and ensuring that, this was an experience for all to be able to experience along the way, we really forged an effort around less words, more signals, more pictures. And so we just consistently look for ways for us to build patient experience in as we think about how we're helping design these sites and the experience that builds confidence and puts people at ease.
I think I read about another piece you solved for, which is kind of the crowding in waiting at different stages, and particularly at dismissal while people wait to be told they can go home. Can you talk about that challenge?
Absolutely. We learned that, there certainly is this waiting area, as you mentioned, and these 15 minutes. And, we had a chance to see some of the bottlenecks that were in this system. Patients were waiting much longer than the 15 minutes. And we know if that area becomes full, it backs up everything else. So we spent a lot of time with our human-centered engineers to focus on the workflow, and from a patient arriving and what they experience in the wait time, to how many registration desks, to how long would they be at a vaccination station, and how might you make some small tweaks, whether it's number of registration stations or the ability for the vaccinator to solely vaccinate and not worry or be bogged down by the administrative tasks. So there were those tweaks, and that really wasn't an ability for us to focus in on what you're speaking to, so that this waiting area doesn't become burdened. And in addition to that is, how might we design the waiting area where, the medical providers that are watching and being there for these patients after they receive the vaccination, how they might easily be able to integrate through these patients and just check whether it's the time that's now put on the slip or their sticker, or just having a simple thing of clocks being available. So we really looked at the full system to ensure that those bottlenecks didn't happen. And then we really lasered in on how we could begin to evolve what the experience looks like in those 15 minutes, again, to provide this experience and reassure them and give them the ample amount of care, and be able to clearly signal that they can move then to exiting the clinic.
We have an audience question that relates to that I'm going to throw in here in the middle, which is, that's such important learning, and it really transcends just the pandemic. Do you imagine sharing this learning across the health system when we get to the other side of this? Because patient experience is, of course, something, a lot of the lessons you just mentioned would help patient experience across the board.
Yeah, you're absolutely right. And I will tell you, we're very excited in this coalition. We are working again with Governor Inslee and Challenge Seattle to be able to take all of these learnings, be able to provide a playbook and all of the lessons that we've had and the recommendations, whether it's to increase throughput or experience, and be able to actually move them into a document where this could become open sourced. So anybody across the state or any organization can benefit from the lessons that we've had along the way. So we're working diligently towards that.
You're, of course, also a massive employer. Let me ask you the same question I asked Brad. Do you imagine requiring vaccinations for your employees at some point?
Yeah, thank you for the question. I very similar to what Brad had mentioned. Our stance has been always to keep the safety and the well-being of our partners and our customers in the forefront. And, we will and continue to take a stance on highly encouraging and recommending, right, our partners, as we call them, our partners to get the vaccine when they're eligible. And we've done this in a couple of ways. We know there's a lot of information out there around eligibility and where to actually get the vaccine or where they could sign up. We've made all of that information accessible to our partners so that they can make the best decision and they have the up-to-date information right at their fingertips. And then second, we've really built a lot of information around education, bringing in medical providers, experts, scientists, just to help continue to build education. A hot topic and continued conversation is around these variants. And this brings a lot of questions for our partners. So we've had a very big rigor around providing this level of education for our partners so that they have a place where they can ask those questions and hear the science and facts to make the best decision for them. So we'll continue to encourage them, but no, we would not be requiring them.
Do you imagine setting up kind of your own vaccination sites for your own employees at some point?
No, this effort really is to support our efforts to support the communities. And our role in this coalition is really to be in service and support of Governor Inslee and the Department of Health, and best understanding how we can leverage our expertise to increase the number of vaccinations and do this in an equitable fashion. And so at this point and for the future, the answer would be no. Our efforts are really on ensuring that we are providing the service and support to our community effort. And quite honestly, we will wait our turn like everybody else.
When you think about the next 6 months, a question I asked Brad a second ago, what makes you optimistic?
If I think about the last year, watching our communities, our partners, our customers be so resilient, find silver linings, be optimistic. Our partners have been on the front lines and continue to provide, like to your teenage daughter, these moments of connections. And I see such hope over the last year. And now that we're having these conversations about how we might continue to accelerate with more providers, more supply coming, and demand that's there, I am very hopeful and optimistic. And I cannot wait as I think about the 300,000 plus partners that we have around the globe. I just can't wait to have a cup of coffee and share a moment of connection with them. That's what gives me the most hope and excitement for the next 6 months.
Shannon, where would you go to have that cup of coffee? You think a Starbucks? Maybe a Starbucks?
Maybe a Starbucks, or maybe many of them. It's the best part of my day, and I spend time in Starbucks, every week. But I'm excited to be able to do that more often, and even think about around the globe.
Well, we can't wait to host you here in the other Washington. Thank you personally for what you've been doing and what we can all learn from it. I'm looking forward to staying in touch. I'm sure that we have audience questions for you too, but let's bring all the panelists back right now and run through some audience questions. And Governor, I want to start with you. One of the audience question we have for you is, are you hearing from governors and state officials in other states who want to learn from what you've done there in Washington?
Well, the other governors, there's a lot of talent in the other 49 states, but they realize there's no way they can match our performance in virtually anything, of course. So that's a difficult thing for them. No, I actually have not talked much with my other governors, and it's something that's on my to-do list to talk to the National Governors Association about this subject, because I do think there's lessons that other people could learn. And so this is on my to-do list. I know that Brad and Shannon will help me in this regard.
We had Governor Justice of West Virginia on, and he might take the challenge. He feels pretty good about how many people they vaccinated in West Virginia, but I'm not going to get between you.
They've had a good success in West Virginia. It's good to see him number one.
Yeah, it's funny. Brad, let me ask you a question here from the audience, and it is, do you have any ideas on what small business can be doing to help? I mean, as they're watching this program and people are saying, I want to step up too, what advice do you have for them?
Well, the first thing I would say is every business, large and small, can get its own employees ready. Because we are going to reach a point before we know it when there's more supply than demand, even though that sort of sounds like an amazing thing to even contemplate. And I think the more employers can be using their voice to encourage their employees and their employees' families, I think the better. I think beyond that, it really comes down to the local community or state and just knowing what arrangements are in place and whether there are opportunities for people to plug in. One of the things that we are finding is that for every vaccinator who works at a site, there typically is a need for 2 support people. And a lot of these folks are volunteers. And if you can lend employees to work as support personnel, really thanks to the kinds of expertise of a company like Starbucks here, or no doubt other people in other places, I think volunteers can be put to great work to help people navigate the process. And that's what a small business everywhere may have. If you have somebody you can lend for a day or a few days, I think they can make a real contribution.
That's a great suggestion. I appreciate you bringing that up. Shannon, let me come to you for a second. We have an audience question about masks. And, I don't know, I'm sure you know this, but we had the president of retail, your president of retail on this program early on. And she was really helpful in helping our members think about how you talk to customers about masks, how you don't put your employees in a situation being confrontational with your customers. I mean, really gave a number of business leaders across the country some great advice from your learnings on that situation. It feels like we're back there a little bit now with states starting to relax their mask requirements. So the audience member is asking, so how will Starbucks make that decision? Is it state by state? Is it region by region? Or is it corporate?
Thank you for the question. As we, just as you referenced in the beginning, as we talked about facial coverings and made the decision to move that, we've rooted ourselves in science and facts from the beginning, and very linked into CDC and our physicians who are pointing us in the direction of what's best as we think about navigating this pandemic, and aware of what's happening in some of the states across the country. But we will continue to root ourselves in science and facts and make those decisions from there. So as it stands today, facial coverings will continue to be part of our expectation as we think about how we might keep our partners and customers as safe as possible, again, rooted in science and facts.
So, Governor, coming back to you for a second, an audience member is asking, how important is it to have someone in your office who really understands how the private sector works? I mean, in putting together a strong and effective public-private partnership, do you need somebody with expertise on what you can even ask these great companies in your state to do?
Well, you certainly need expertise. The question is, do you need a professional resume that has been in private practice? Obviously, that's something that would give you a leg up. But I have to tell you, I'm just thinking of my staff who've been working with Brad and Shannon, and I'm just thinking right now, I don't think very many of them have had a private enterprise experience in their professional lives. But I wouldn't trade them for anybody. I think they're doing a crackerjack job. You need smart people who are creative and adept and good listeners and know how to build partnerships. And at least people in my shop, I think, are being successful doing that, even without being president of Microsoft quite yet. They may be someday. So that would be my answer. Look for talent, draft the best available athlete, and go make a good partnership with a business.
That's perfect.
The other thing, if I could just add, is it's sort of common sense. You need great communication. And one of the things that Governor Inslee has done is he's brought us together, a small group of business leaders. We were meeting once a week. Now we're meeting once every other week. And, it's an opportunity to sort of take stock of what's working, talk about the challenges we're addressing, really think about what's next. What are the problems we're going to have to confront when supply is, say, double what it is today. So that communication led by a governor, I think, is just of enormous value. The other thing that I do think has been just fascinating and so important is for us in the private sector, we have learned quite a bit about how the public sector works, and I think vice versa. And it's one of these classic cases where I think if you go into it with a huge amount of respect for what the other person brings and then ask them what they need, rather than assuming that what works in one place will work in the other, it makes all the difference. But it's one of those classic examples that a lot of times what matters most in life are these things that you learn when you go to kindergarten or first grade. And having somebody, as we've had here with Governor Inslee, to bring us together makes all the difference in the world.
It's interesting you raised that. We hear that a lot about public-private partnerships. Our Center for Corporate Citizenship, for example, does a lot of work in disaster relief. And it's exactly that. If you don't go to people on the ground, listen to what their real needs are, and then coordinate and communicate about a response, you can do as much harm as good in trying to go in and help disaster relief. So I think that's always an important part of a public-private partnership, is that listening first and really identifying the needs first. Let me lift up for a second. Brad, I'm going to stick with you for 1 second, and I'm going to ask a similar question of both Shannon and the governor. You mentioned that it's been about a year that Microsoft has been working from home. And an audience question we have about that is just, what have you learned about either yourself as an executive or the company in that time that you'll hold on to when we are back to a new normal?
Well, I would say three things. First, technology makes it possible for us to do things that wouldn't have been possible a decade ago. It's really impossible to imagine that we would have been as successful in, say, the year 2010 of making it through this year the way that we have, thanks to the great technology that we do have. Number two, people still need to be with each other. One of the things I said I've learned about myself is I'm never going to volunteer to go to Mars. I really prefer to, be with other people, and you learn how much you frankly rely on all of the nonverbal cues that you get from being with people in a room and reading body language, building networks, informal interaction, transitions during the day. But then number three, I think that what we have the opportunity to do, 3, 6, whatever many months from now, is bring the best of both of these things. It will mean that people can work from home probably more frequently than before. It will mean that a young parent may find it easier to stay in the workforce and have young children and work from home. It will mean that there will be certain trips we won't take because we can do a 1 or 2 hour meeting by video. And yet we'll also, I think, get the best out of in-person interaction as well. And that's what I hope we can really be focused on, say, a year from now, among other things.
Very well said. Shannon, how about you? What did you learn about yourself or your company in this time?
Yeah, our mission to inspire and nurture the human spirit could not be more relevant than it is today. So as we grounded ourselves in our mission and values and our principles as we navigated this pandemic, and I think about the future, and what gets me so excited is the role that we'll continue to play to provide this third place where we bring people together across the globe to have moments of connection over coffee. And the role that we have the privilege and honor of playing in this space and providing these environments to do that very thing that we're all longing for. So I would say our ability to bring our mission value and to continue to stay anchored to that, and the ability for us to bring people together because we're longing for it in so many ways.
Both you and Brad had such elegant answers to that question. My answer is always that I've been shocked how much I can do without shoes on. I mean, it's a remarkable thing. And that I actually miss airports. I mean, who saw that coming? So it's a time of learning and a time. I think what I miss the most, I'm joking about airports, but I think what I miss the most is serendipity, spontaneity. The idea that you run into someone even in the office or in a hallway, and the idea generation that has, or the creativity that it spawns, or an old connection just running into someone somewhere. I think that's what I can't wait to get back to. So, Governor, I didn't get to ask you the question about what you're optimistic about. So how are you feeling about the next 6 months, and what makes you optimistic?
These vaccines, they're dynamite. This 90, 95, 96% efficaciousness rate is incredible. And the experience we're seeing in Israel and Scotland of knocking down this virus is titanic. It has stunned the scientific community to have something that is that effective. And this virus can make fools of us all, but I do believe we have a reasonable possibility to be in a condition, in summer and early summer that we never could have imagined on the health side because of the efficaciousness of these vaccines. And that's really exciting to me. And I'm trying to prepare our state to think in those terms, to hustle up on the vaccination effort because it's working. And now here's the challenge. At the moment you ask me what I'm optimistic about, I never miss an opportunity to talk about the challenges. The challenges are people see these vaccines. We cannot take off our masks. Repeat, we cannot take off our masks. These variants are too transmittable. It is clear that we're experiencing a plateau or a rise in these infections right now. And a rush to the excess is just deadly right now at this moment. So yes, there's huge optimism. Vaccines are going to be dynamite for us, but they're not here yet in mass. And so we've got to continue some of these basic, they call them non-pharmaceutical interventions, NPIs, which basically means wear a mask. And by the way, you know what the masks have done? It's knocked down the flu fatalities by about 80 or 90% this year as well. So I just share that comment with everybody who's listening here. We got to keep our shoulder to the wheel here for a few more months anyway, so these vaccines can save us.
It's interesting, Governor, we did one of these programs a couple of weeks ago with some experts on the variants. And one of the things that they were quick to point out is that when a variant is allowed to be in the body and learn the body's mechanisms longer, that's when it has real success. And so one of the reasons that you want to wear masks is that even the asymptomatic carriers get the variant, and then and then the variants get stronger. So I think your point is well stated and important for us all to realize. I think it's so important. The challenge I see with the vaccines right now is and I think you've all three said this, there's so much demand, and people are both excited about it and nervous about it. Will I lose my place in line? What will happen? I have a place in line. There are 50,000 people ahead of me. The anxiety that Shannon mentioned, I think really does come out in line wait. I'm not sure that human beings are meant to wait in line generally, and certainly not specifically when it's a life or death issue. So I really applaud, Brad, the efforts on the trackers, because I think facts help in this situation. And the more you demystify the process, the better. So kudos to you, and really to all of you. I appreciate the opportunity to learn from you. I know our businesses do as well. And so I hope you'll come back and teach us what you've learned and help share that wealth of knowledge with others around the country. But thank you very much for being with us today.
Thank you.
Thank you.
To the audience, I want to say thank you for being with us. We really appreciate it. If there are business owners in the audience who are inspired by this program to figure out how to get involved and to help get our nation back to health, please join the Chamber's Rally for Recovery commitment, and you can learn more at uschamber.com. If you've missed any of our previous discussions, you can find them on uschamberfoundation.org or on YouTube. And we're really looking forward to March 17th. I hope you'll come back and join us. We have two fascinating guests that are helping us start to think about Disease X, the next pandemic. This isn't necessarily a reason to be pessimistic. It's a reason to be optimistic that all of the learning we're going through now will mean that when a disease X pops up, we'll be better able to take care of it more quickly. We're going to be joined by Director General Rafael Grossi from the International Atomic Energy Association and Dr. Tara O'Toole from In-Q-Tel for this discussion, and I hope you'll be there. In the meantime, wait patiently in line, wear a mask, and take good care of yourselves and each other. We'll see you soon.